the tower, everything. Now we can actually get our hands on it, see where all the buttons are. The nice part is there's not too many buttons when it comes to using standard Bronx. So you're gonna have where the scopes plug in to this box. This is your light source. This is the computer basically. So anytime you're using it or unplugging or plugging in scopes, you want it to be off. Now not everybody listens. It doesn't, 99 out of 100, nothing will happen. But technically it could search the scope if you leave these on and plug it in. So I always recommend turning at least the light source off anytime you're plugging in, plugging out. But you have your 2 power buttons here. And then you have your scopes all look like this. I think you guys might have some 180 versions, which 180 versions would have a little port, like a little cable, like this cable right here. You'd line up the dot and you would plug it in and twist. And you'd see a yellow dot here and the yellow dot here, and you'd just line it up and twist. But most of the Bronx here that are still in use, I believe, are all 190, so you all don't have any cables. One thing to notice, these gold bars right here, that's where all the image is being created. So if you plug a scope in and it stays looking like the screen right here, you can wipe this off with an alcohol wipe, and sometimes it'll clear some film off of there from reprocessing and get the image back. But you'll see there's a white dot here, there's a gray dot there. You just plug it in and it'll seat all the way in there. And then when you turn it on, you can see when you plug it in, it doesn't give you a light right away. So to turn the light on, it's right here. And then you can see on the left side of the screen over there where it says white balance and complete. So these scopes, anytime they go out for service or you get a new one or X number of uses, it'll tell you to white balance them. So to white balance, there's these little caps right here. Now, those usually go missing. If you don't have one, using a 4x4 and just covering it over will do the same thing. But you'll put it in there, and then there's a white balance button right here on the tower. And you just hold it down, and it'll say adjust, and then complete. When it comes to plugging in the scope, those are all the buttons that you'll use. The only other thing that I ever really talk about is this is your brightness right here. It's gonna automatically shift the brightness depending on what it's looking at. So I wouldn't be surprised if you're outside the body and then you like go into the ET tube and it's a little bit dark. It's gonna brighten up in a second or two, and then you'll be normal, don't have to do anything. But if they ever did want to increase or decrease the brightness, it's right here. So with all the scopes, they all use the same suction adapter and biopsy channel. So the suction adapter looks like this. And you can see there's this little white line right here. You'll just take that and you'll push it in there and you'll hear it click. And then it's on there. If you want to take it off, I think it's easiest just to pull this down and then it pops off. You can take these on and off. Like sometimes I've seen people like switch scopes and they don't use multiple of these, and they'll just pop this one off and put it on the next scope. Then you have the biopsy port. So the main thing that this is doing is it's a one-way valve, but it's at the same time. But this just pops on here. You just push it down on there. And it'll sit like that. The thing with this one is once it takes off, it's not going to go back on there, because you'll just peel this back and it'll come off. It's a one-time use. This is one-time use as well, but you usually can go in between scopes if needed. And then as far as other things with the scope, that's about it. Is there any questions that you guys have with scopes?
So white balance, do you do that only once?
Yeah, so most times it's only once, and then maybe 3 months later it'll pop back up, or if it goes out for service. But it'll tell you there'll be like a blue little message on the bottom of the screen that will say white balance required. And also, anytime that you see that blue message and you don't know what it is, and let's say you're on a bedside bronch and you just need it cleared off the screen, on this keyboard right here, you can hit the escape button, just like an escape on a regular keyboard, and it'll clear that message off. Now, when you turn it off and turn it back on, that message is going to reappear. But in any situation, you need to clear it off fast. That's the easiest way to do it.
Okay, can you do that white balance again so I can get
a
real close up?
So you would use this right here. and then the white balance button is right here, and you just hold it down, and then you'll see it says adjusting, and then white balance complete.
Okay. Good.
I have another question, so
Yeah.
will these results print out, or will they be connected to the chart?
So it depends on how the tower that you guys are using is set up. So this one is all, there's not a printer on this one, so it's probably set up to Provation or whatever capturing system that you guys
Yeah.
use.
Well, I was told that if we use the one in OR6, that if we take it to the bedside, we have to bring it back, plug it into that room because they're linked to the room before we can download information.
Yes.
Yeah. So that wouldn't be us doing that. That would be endoscopy, but we're trying to get our own for respiratory, our own machine as well. So we don't have to worry about them.
And I would say if you guys are using, like this one's stationary, this one's not
Yeah,
rolling
it's
around.
not rolling.
So this one's wired to go straight into the computer. A lot of times travel carts will have where you go back to somewhere and plug in, or they'll print off so that you have something there. It just depends.
Yeah, they have to go back to OR6 to plug in to get that information. Any other questions? Kind of simple. Now this is just a setup of the scope itself, the white balancing, hooking it up. All the other stuff, like which doctor specific, will come from the individual doctors. I need to know what their quirks are as far as what they want on the carts and all that stuff. But this is really basic, and I think Maisha has done this too, as well as myself. I'm not sure who else has, but it's really easy. It's not that hard. It's just learning the doctor's quirks of what they want.
And a lot of times when you're doing standard bronchs, especially in the bedside, there's a ton of things that you can change and do when it comes to more advanced stuff, but as a sense of bedside bronchs, those are the main things that you're going to do. I don't see most people enter their patient information on the back end versus on the screen. Like you could type in the name of each patient, but a lot of times when you're just doing a bedside bronch, you're going there relatively quickly, doing the bedside bronch, coming back and getting the images afterwards.
Mm-hmm. Yep. Any other questions or any close-up buttons we need to go over again while we have them here?
Is this a newer system or older system?
Newer, it's not the newest, but we just started selling a new version within the last 8 months, so I wouldn't say this one is the newest, but it's not necessarily old or end of life. I mean, you can see this one's started to discolor, so it's probably up there in age, but the technology is not that.
So on the towers we would use, the only machines that would be on that tower would be what again? It would be those two
these
that we're looking
boxes.
at? Okay.
Yep.
Cool.
And you can see. So you have what's called the release button. So that's what capture or image would be. So it's programmed on the scope, but if they ever wanted you or you guys to hit it, then you would just hit this button here. It's probably not going to save an image right now because it's not turned on to save. But there's also, you can see on there, they have it set up right now. That's on the left side where it says scope switches, right here. That shows you what each one of these buttons, when the physician hits them, what it does. So if 4 would be release or capture, so if the physician hits button 4 right now, you can see it's green, it's showing you which one's which. But that's how they would capture an image. It's going to give this error message because I don't have their Provation or whatever they use turned on. But button 4 is how you can capture, or the release button up here.
Okay, cool. And as far as the scopes, we're in a position right now where the logistics of this bronch is not clear because we only know that Dr. Hahn, the chief of staff, wants us to do bronchs, but the scopes aren't ours, and they have to be cleaned in a certain time period. So we have to just devise a plan to pick them up and to drop them off so they can be cleaned. That hasn't been discussed. All that's been talked about was we need to learn how to do or set up the bronch.
And so when it comes to immediately following the case, you guys will probably do the pre-cleaning
Yeah.
side of it. which depending on what they have here, you have a sponge, some sterile water. Sometimes they have little packets that are like a pre-cleaning packet. First watch or first step, I think is one of them called. But you'll always take and you'll wash the scope all the way down, and then you'll take and you'll put this in the sterile water, and you'll suction for 10 seconds, then suction air for 10 seconds, and then you would be done. So you wipe from head to toe, suction for 10, and then suction air for 10.
So they don't need to go to central sterilization?
They will afterwards, but
Okay.
that's just immediately following the procedure. That's your first step of cleaning. And what the IFU is going to say is within an hour is when they need to start
It was
being
an hour?
cleaned.
Okay. I wasn't sure what the time limit was. Yeah, because they have to put a brush through there too and everything else too to make sure that stuff is out of there. So
Now
it's,
it's coming in. I'm going to go grab her at the door. So as far as buttons, we talked on pre-cleaning.
mhm.
Is there any other questions about bronchs in general? One other thing. So when you're picking scopes, your model number is always going to be right here. And then your working channel size is right here. So working channel is probably going to be the most determining factor when it comes to pulling a bronch. So your therapeutic scopes, which is what this is going to be 2.8. And then you have what's called diagnostic scopes, which would be 2.0. So if they're doing any big suction, of course, they're going to want the larger, like suction out, bleeding, any of that, they're going to want their larger one. And then the 2.0 would be anytime they're going to look at something, take a biopsy of a mass in the airway, do something a little bit with a little less suction.
So for images, is there another way to snap an image besides on the scope itself? For instance?
Yeah, the release button up here would capture your image.
Do you have physicians that don't like to take the pictures themselves?
Not sure.
Okay.
Yeah,
What,
I've
what
had
type
to
of
snap
image management are you guys using?
I don't know because endoscopy has always had control of these machines, and so respiratory was only asked to come in the room to put the adapter on them and put the vent at 100%.
Okay.
So as far as what they have, I'm not sure.
So it's probably some form of, if you're doing it in endo, it's probably probation or GMed.
Mhm.
You'll have to pull up the capture screen. Have you guys done that before?
No.
Yeah, so there's either going to be a printer or there's going to be some sort of computer that you're going to have to go into the patient file. You're going to want to get to like a capture screen. You should be able to see on your computer that scope image.
Mhm.
And each time a picture is being taken, it'll transfer over to that computer. So as you guys are starting doing the cases, I would recommend that you take a picture by yourselves before the physician and the patient are in the room,
Yeah.
just to confirm everything's moving over. That goes right here. So there's like an internal memory here,
Mhm.
and then there's a memory here for
Okay.
your pictures.